I'm here to introduce you to Concentrx Pharmaceuticals, a company that we've been working on for almost a decade. We basically founded the company to improve inhaled drug delivery, and we feel like we've accomplished that. This is the standard of care currently, has been for 70 years. These things are very inefficient. We've come up with an inhaler that we think will rival this in a very positive way. See if I can get this to work. So we've invented a product called Halix. It's an inhaler. It's a unit dose disposable dry powder inhaler. It costs 2 cents to create, and it's or 3 cents, and a little bit more to fill it with drug and to distribute it. But having said that, it's indeed a big innovation with a lot of potential, and we believe that we are going to improve the quality of care with this product. This is Halix. It's a unit dose disposable dry powder inhaler. It costs 3 cents. It's one piece of molded plastic. It's more efficient than anything that's on the market right now. We tested it against Ventolin inhaler, this thing, which is the standard of care for bronchospasm and asthma and COPD patients, 70 million prescriptions a year in the United States. Halix will rival this product and give patients better care at a lower cost and more convenience. We also have, this thing's not working very well, I'm sorry. Next slide, please. We also have a nasal version. We don't plan to develop products ourselves in the nasal version, maybe 1 or 2, but probably mostly this will be for out-licensing for drugs that will be administered in the nose. We're going to concentrate on respiratory products for asthma and COPD in the lung. These other indications will hopefully find partners. Here we go. So in terms of our needs, we're seeking $6 million Series A financing, of which half of that money will be spent buying equipment to build a factory that will produce Halix at high volume and high speed, about $5 or $10 million a year. We need $1 million for, that's $3 million for the equipment, $1 million to complete a second clinical trial for our US application, and about $1 million for 2.5 years worth of operating expenses. The rest will be reserves. So our internal focus, as I mentioned, is going to be on products for respiratory disease. The 3 that are listed there, I'm very familiar with. I launched all those products. I managed all those products. The combined sales since 2000 is $150 billion in the US. That's those 3 drugs. The biggest one is this combination drug, salmeterol, fluticasone, Advair. You might know that one. Fluticasone is Flovent, and albuterol is this Ventolin. It's also, Teva's got one. It's called ProAir. They're the same drug. Combined sales has been tremendous, and we are selling doses, not inhalers. This is data from a study that we completed for the FDA, which shows improvement in lung function, comparing both albuterol from a metered-dose inhaler as well as our Halix. As you can see, the numbers are very similar, but you notice on the bottom that the Halix had only 90 micrograms of drug, and the Ventolin was 180. So it shows that we've improved the quality of delivery, getting more drug to the lung with less effort in more people. And so I'm running out of time, and this thing here has not been much helpful. This is our team. My experience with Glaxo, 16 years, 10 years managing these products. Eric Richardson's the inventor of the inhaler, Halix, and our medical director and head of FDA is Jim Alexander. We all work together and known each other for more than 25 years. We have patent protection in 42 countries, 15 patents issued at this point for Halix since we started. The first launch will be in the UK and Ireland because the regulatory affairs are much easier to deal with there. So basically our exit strategy, 5 to 6 years, we'll have revenue in 2 years. The big ideas here are that this is an inhaler with a great opportunity, and we'd love to talk to you about it further if you have the time and the interest. Thank you very much.